Hey, what up y'all, it's me, your boy, Lil D, coming at ya from the den with another nursing video. And today we're going to talk about patients leaving the hospital against medical advice, AMA, and my experience with this and how I have sometimes taken this offensively and made it guilt for myself when, as nurses, we really shouldn't. Nurses, we're faced with a lot of things coming at us, and sometimes it can kind of feel like it's our fault, that the patient is blaming us, or that things are happening to the patients because of this. And sometimes we can leave the hospital feeling guilty or like we didn't do enough, when really this is just the line of work that we're in. About a couple weeks ago, I had 4 patients, because we have 4 patients on my neurotelemetry unit, and I had 3 of them threaten me to leave the hospital against medical advice. Now, I have been a nurse for 3.5 years, and when I first started nursing, I remember I used to take this as like, oh no, we're doing something wrong. The healthcare that we're providing to them isn't good. But really, this falls back on the patients. So 2 weeks ago, when I had this going on, there was one patient. She was getting so mad at me. She was wanting to get her dialysis done, but they can only get so many people done in the hospital at once. And she said if she didn't get it done within the next hour, she's gonna leave, and she'll just follow up with it on Monday. Granted, this is the reason that she was in the hospital for the first place. But instead of getting upset, I told the patient, you know what, if you want to go, you can go ahead and go. I'm not holding you here. I have called the dialysis unit and I asked them how long it would take, and they told me that you're about second or third in line, and that's really all I could do. But if you have to go, then that's fine. Just go ahead and give your ride a call and go. And that's not me being mean. That's just me being real. The patients are in the hospital because they want to be. They come to us for help. We don't go and find them. Like, we're not holding anyone hostage. Now, I had another patient in a different room who did leave. The patient was getting very fidgety, very agitated, and I guess this happens quite frequently. And then the husband at the beginning, the husband was saying, I'm not going to take you home. We need to get you cared for. And we were working together to get the patient to stay. It had been a couple hours, and the husband eventually gave in and said, you know what, we're getting out of here. And I was like, that's fine. If you want to take her home, you're allowed to. You're her husband, her power of attorney. And if you guys don't want to be here, that's fine. So I had them sign the papers and they left. And normally when not normally, but when I first started nursing, it would be as if this was my fault, when it really isn't. And I think that's hard for nurses in the beginning to understand. Well, at least for me it was. I left the hospital so many times. So understand this. I've been at the hospital on my unit for 6.5 years, 3 years as a nursing assistant, 3.5 years as a nurse. There have been so many times when I have left the hospital crying, and really I don't have many people to talk to unless they're a nurse that would understand the stuff that I'm going through, because when I explain this stuff to my mom, she's just not very comforting. She doesn't understand. She thinks that I should be doing more. But I'm trying my best. And there have been times when I've gone home crying about how the day has gone and how I feel it's my fault. But when really I'm just doing the best that I can. I'm calling for help when I need it. And things aren't always going to go how you expect them to go. In regards to patients leaving AMA, sometimes it's better to not fight them. And sometimes it's better to just let them go. There comes a point where there's only so much that we could do to make them stay. And in some cases, I do feel like the patient really shouldn't leave. So I do put my best foot forward to make them understand the risk factors and everything that goes into them leaving. And then other times, they're coming at me so badly that it's just easier for me to say, go. I'm not being mean, go. You don't want to be here? I don't want to provide care to you anyways. Go. There's other people who need my help and want it. So if you have gone through any of these feelings, or if you've come across a situation like this where you feel guilty, go ahead and leave it in the comments down below, and I understand what you're going through. We can talk about it. If you haven't seen enough of me, go ahead and watch one of my other nursing YouTube videos. Make sure you give this video a like and subscribe. This one is a little bit different, but I thought it was important to share and get more down on a deeper level for once. I'll talk to you guys later. Thanks. Bye.